Good evening, everyone, and thank you for joining us tonight. Welcome to the Avexia webinar series. Tonight's topic is Functional Medicine Approach to Irritable Bowel Syndrome. My name is Robert LaCroix, and I am the Director of Marketing at Avexia Diagnostics, and I will be your moderator for this evening. Let me introduce Dr. Wayne Sedano, our Director of Clinical Support and Education for Avexia Diagnostics. I will now turn the webinar over to Dr. Sedano. Thank you.
Welcome, everyone, and thank you so much for joining us this evening. So let's go ahead and dive right in. We're going to be talking about, obviously, as you see in the slide, the functional medicine approach to irritable bowel syndrome. So let's go ahead and get started. And here we go. So this is a slide I'm sure that you all have seen one time or another, but it's worth taking another look at it. Of course, many, many years ago, Hippocrates said all disease begins in the gut, and I certainly agree with that, and that's why you see the slide up there. So what I want to start off with is this introduction to integrative gastroenterology. Just give you a little bit of history here. So early in the 20th century, like it says on the slide, there was this Nobel Prize laureate. His name was Eli Metchnikoff. He's the guy that introduced that term dysbiosis. He called it dysbacteriosis, but the point was it was to describe the opposite of symbiosis. In other words, the microorganisms working in concert with us for health, for that mutual harmony. Now, dysbiosis, as you probably know, it's a potential trigger of many diseases. And just like, once again, it says on the slide, it's commonly associated with all kinds of affliction, diarrhea, constipation to inflammatory bowel disease, obesity, cancer, diabetes, allergies, and asthma. And just like it says on the bottom here, that since impairment of the GI system can have profound effects locally and systemically, and that includes, like I haven't read there, psychologically, because there is a connection. I don't know if you're aware or not, but the bacteria, the good bacteria, are able to produce neurotransmitters. And you know, if there's a dysfunction of neurotransmitter or a disbalance, of course, that can lead to psychological problems. So GI really rules from an integrative medicine perspective, and particularly integrative gastroenterology. So let's dive right in and talk about the 4 questions that you need to ask when you're thinking about restoring GI health. So let's go over them one by one. First, what noxious substances need to be removed from the gut, from the GI tract? A great way to take a look at that is to look at a stool analysis, particularly a GI map or other stool analyses that can give you a real insight on what's going on, what needs to be removed. Talking about the pathogens that will present themselves causing disease, dysbiosis, and so forth. And next, what substances need to be replaced? Does the individual have, say they had their gallbladder removed and they need bile salt replacement? Or is the pancreas not functioning properly where they need pancreatic support, or there may be a low production of hydrochloric acid in the stomach that helps break up the protein so the digestive enzymes could break them down to amino acids for absorption? Next, what substances are needed to support and or reestablish a healthy balance of microflora? That is where that term reinoculation comes in. In other words, getting the proper beneficial bacteria back into the gut. Remember, this bacteria, not only are they able to make neurotransmitters, they're able to make vitamins, they're able to support the health of the GI tract, anti-cancer by creating what's known as short-chain fatty acids and so forth. So that's really what that's about in regard to reinoculation. And finally, what substances are needed to repair and regenerate a healthy intestinal barrier? So when you have a patient with bowel, it doesn't matter if it's irritable bowel syndrome that you're looking at, even inflammatory bowel disease, these are the 4 primary questions to take a look at, and we're going to explore them one by one. So let's talk about remove. What needs to be removed? Sure, certainly the pathogenic or potentially pathogenic bacteria. Those are those opportunistic bacteria that under normal situations, their count is low when they do a stool analysis, but as they become high, bacterial overgrowth, I'm sure you may have heard of SIBO at some point or another, which is the small intestinal bacteria overgrowth. When bacteria become overgrowth, that can cause a lot of problems. Yeast is another one, parasites, certainly food allergens, food additives, preservatives, MSG, all of that needs to be removed. And also food intolerances, when you figure out that, hey, is this person lactose intolerant, or there's something going on with histamine as well. Remember, you need to remove the offending foods, medications, gluten excuse me, if they're sensitive to it. But I think when you're starting out with a gastrointestinal problem, I think it's a good idea to remove the gluten anyway, whether they're sensitive to it or not, or if they're celiac disease, because wheat may have glyphosate on it, which can cause bowel irritation and so forth. You certainly want to remove poor quality fats, refined sugars, and fermented foods. You want to eliminate that. You need to clean up the diet. So that's really paramount. Now, to help remove the pathogenic and potentially pathogenic bacteria and microbes, you want to consider antibacterials, antifungals, and/or antiparasitics. You lump that all together, and we call that antimicrobial therapies. I'll be showing you some tonight, some natural medicine antimicrobial therapies that work extremely well. Next, replace. So like I said before, what are we replacing? The digestive enzymes. You can get that information if they're low on, say, pancreatic enzymes by looking at a stool analysis, because a lot of stool analyses, they're going to have what's known as intestinal health mapped out for you. I know the GI map test has that out, other stool analysis, comprehensive stool analysis. They're going to take a look at digestive health by looking at pancreatic enzyme 1, and if the individual is low on that, well, that means you need to restore some digestive enzyme, give them some support. Like I said before, if the gallbladder has been removed on the patient, bile salts will probably need to be replaced. Remember, bile, not only what bile does, it emulsifies fats so they can be digested. If someone has missing a gallbladder and there's not enough bile that's squirted into the intestine, if you're giving them essential fatty acids, they may not break down enough or become emulsified where they can be absorbed. So that's where bile salt replacement can be extremely helpful. Like I said, stomach secretions, if they need hydrochloric acid, extremely important, because that with hydrochloric acid, it's not a digestive enzyme, but what it does, it breaks down proteins so the digestive enzymes can work on the protein and break them into tripeptides, dipeptides, and also amino acids. So that's what you need to consider to replace. Next, reinoculate. Like I said before, you reinoculate with what? With probiotics and then prebiotics. Now, there is a little bit of caveat with giving some probiotics and prebiotics. Like you see, I have it highlighted in red here. You want to be extremely cautious with severely ill patients when you're restoring and looking at putting probiotics and prebiotics back into the gut. Down on the bottom here, it says caution prescribing probiotics and prebiotics if you suspect SIBO, and also a condition called D-lactic acidosis. Now, there are certain probiotics that will produce D-lactic acid, and you would pick that up on an organic acid test. And I point that out because that can be, some bacteria actually produce that, some good bacteria, like it says on the bottom. A lot of the lactobacillus bacteria, which are good on the probiotics, they are D-lactate producing. That can cause a lot of neurological symptoms. The way to check for that is to look for D-lactate, order a laboratory test, which we have at Avexia, and or do an organic acid test, which you also have at Avexia. So that's one way to take a look at that. Next is repair and regenerate. So what are we going to use to repair and regenerate? Vitamins, minerals, fatty acids, some phytochemicals, which are plant chemicals, some specific supplements to help repair and regenerate the gut. As you see on the slide here is L-glutamine, essential fatty acids, zinc, pantothenic acid, and vitamin C. And we'll be going over some supplements that can help with that repairing the gut lining as well. That I'll show you a little bit later. So what you just saw was essentially the 4R model, which you've probably heard about. There's also the 5R model, and then there's the 6 principles of restoring gut health. So the 5R model looks like this. Of course, you got the remove, replace, reinoculate, and repair. The 5th one that they've added, and I think it's extremely important, proper rest, proper diet, changing that diet like I talked about, exercise, and stress reduction. And I want to talk to you about stress reduction for a moment. It's really not a whole lot known out there, but you need to realize that there are receptors on the cells of the gut, the enterocytes, the colonocytes. There's these little receptors. They're corticotropin receptors. Now, what do I mean by that? They are they are receptors that can respond to corticotropic releasing factor that gets released under a lot of when we're under a lot of stress. And what it will do is, of course, it causes the adrenal glands to release a lot of cortisol. They found out that there's also receptors not only on the adrenal gland to release cortisol, they're also on the gut lining. And what that will do when that runs high, the corticotropin releasing factor, it touches on those receptors in the gut lining and creates leaky gut, which means functional bowel problems. So at any rate, so stress is very important to address with all of these. Now, the 6 principles are right here. Of course, we got the remove, replace, reinoculate, repair, and regenerate. The other ones that they've added to this, and you can look at this in any way you want or address your patient accordingly. But the 5th and 6th one on this particular model is supporting and soothing an irritated gut lining. And we'll show you some herbs and supplements to help out with that as well. Next is to promote detoxification and elimination. That's extremely important because the gut is seeing a lot of stuff coming from the liver for detoxification. So if the individual is detoxifying properly and eliminating and having good clean water put in, it's going to help with healthy elimination and also help improve bowel function. So next, I want to just switch over to this GI map, and I hope you're familiar with the GI map test, but you can plug in any of the wonderful stool analyses that we're looking for. The GI map is really a favorite of mine, but the other ones are just as well and do really well. But here, I put these slides together because you can get some kind of an idea of what kind of antimicrobials that you would want to use for specific conditions. And I certainly suggest that you get a copy of these slides, get a handout. They're available from Avexia, so please take advantage of that. Here, you have some good information on what to remove, what are good antimicrobials. And again, I'll be going over some supplements, but you can get a good idea of what can be extremely helpful for fungus. You got caprylic acid, garlic oil, oil of oregano, olive leaf is really well. What are good antiparasitics if you're not familiar with that? Certainly black walnut, garlic, again, you see a lot of crossover here. Oil of oregano, wormwood is kind of a standard that can really help out as well. What are good antivirals? Olive leaf, pure silver. I know Avexia Nutraceuticals has a wonderful silver product that you can get as well to help out. Reishi mushrooms as well. So this is to put on your desk so you know what are the good active ingredients that could help with these particular antimicrobials, things that you're going to want to go after once you get test results back. Now, replace as well. So here, if you get the test back and there's low, say, on digestive enzymes, well, what are good digestive enzymes? So here, betaine hydrochloric, apple cider vinegar is also a good one. Herbal bitters, ox bile. That's if the individual particularly is low on bile. Like I said, they had their gallbladder removed and so forth. Pancreatic enzymes, lipase, amylase, and proteases, and also pepsin is there. Reinoculate. What do you want to reinoculate with? Certainly the lactobacillus, acidophilus, bifidobacteria of different species here, Saccharomyces boulardii as well, and a list of prebiotics. You have beta-glucans. By the way, that's in oatmeal. So they're fiber, inulin, pectin, and so forth. Now remember, like it says on the bottom, caution when you're prescribing probiotics and prebiotics if you suspect that there is SIBO, that individual is having SIBO, or who are extremely ill. One way that it's kind of really not a sophisticated way, but I've used in my practice, if you're prescribing probiotics, please call the patient the next day or the day after that they're doing that and say, are you doing okay? And if they say, you know what, I'm getting more gas and bloating and I'm just really not doing well, suspect SIBO and you can test for it. So that's one way to take a look at it. Or if you're giving them an antimicrobial and they're feeling better, they may have a bacterial overgrowth as well. So that's kind of a not so sophisticated way, but it can work extremely well, a little clinical pearl there. Now, with regards to repair, there are many supplements to repair. I talked about L-glutamine is good. DGL licorice is good. Marshmallow root, certainly great because it puts a nice coating. Zinc, slippery elm, so forth. Immune enhancement, colostrum, certainly immunoglobulins, and also Saccharomyces boulardii, very, very helpful. And of course, rebalancing the proper sleep, diet, exercise, stress management. I can't overemphasize that as well. Now, let's turn over so now you can get a look at some supplements to prescribe. This is or get very specific on supplementation. The supplements mentioned here are the Avexia nutraceutical supplements that you could consider using and some recommendations. So if there is pathological bacteria that are picked up, opportunistic bacteria, parasites, and fungus, You may want to select some supplements called Gastro-Microbe Essential. Here's the treatment protocol for it. That's two tablets TID 3 times a day. There's a Silver Max as well. It's very helpful. If E. coli shows up, probiotic macrophage, again, BID, 1 capsule twice a day. GastroBalance can help out as well. And I'll let you go ahead and read these, but we have it worked out where you can at least, when you get your test results back, what do I use? Well, it's right here for you. For normal bacterial flora, if there's low commensal bacteria, this is some of the selections you might want to consider. Again, you're the clinician and you need to make the call here, but these are wonderful suggestions and have worked extremely well. You can use probiotic essentials, 1 to 2 capsules per day, or probiotic spheroids as well. Those are the encapsulated ones that can work extremely well. Next, when you get your test results back, like I said, there's a section on the GI map and certainly other test stool analyses. I'm going to talk about intestinal health. They're going to let you know about the fecal secretory IgA. Now, that is the coating of the gut, and it also coats the mouth or secretory IgA there as well. What that will do is that immunoglobulin will recognize pathogens and even food allergens and try to latch onto them so you can just defecate this stuff out. If fecal secretory IgA is low, generally what that means is that there's a dysbiosis going on, immunosuppression with that individual. It's going to give you some clues there that you need to restore. Elastase, that's a pancreatic enzyme. If that goes low, shows low, well, you can help them out with some D-zymes, which has the pancreatic enzymes in it. Again, that's a Vexia nutraceutical product. Also, it'll look for a beta glucuronidase and also look at the fat content in the stool. If that runs extremely high, that's a good indication. You might need to get them on some bile support, some ox bile, liver and GB support as well. 1 capsule for TID 4 times a day with meals. If some of the tests will include calprotectin and also zonulin. Now, if calprotectin runs high, if you're not familiar with that, what that is a substance that's produced by neutrophils and when the neutrophils break open the white blood cell, this calprotectin can be picked up. That's generally a sign of inflammatory bowel disease. Something's not good is going on there, but these tests will check that out. Zonulin, hopefully you're familiar with that. If zonulin runs high, probably leaky gut is going on with that individual. Here are, again, some nutraceuticals, GastroBalance, that can certainly help out with the treatment recommendations of the dosages. Now, if you have a patient that's low on HCl, what I've included in here is just a starting point for you to begin to look at, okay, what would I do for that patient to see if they need some HCl support and some pepsin support. So again, this is all mapped out for you. Generally, what you would do, and if they don't have gastritis here, and I probably should have put that on the slide, if you suspect any gastritis, do not do this because the hydrochloric acid is going to further inflame the stomach lining, and you certainly don't want to do that as well. But you'll know if you give them that starting dose of 100 milligrams, they're going to say they're going to kind of go through the roof, and let them know to drink some water or even some milk just to coat the stomach initially. But if everything's okay, there's no gastritis, this is what you would want to do. You want to start off with a dose of about 100 milligrams of betaine HCl, right? And tell the individuals and walk them through it and see if they begin to feel a warming, this is with meals, a warming sensation in the gut. If they don't, then you tell them, okay, well, your next regular meal, not the small meals, go ahead and do another one. They say if you feel a warming sensation, that's probably your dose and you should be okay. You can pretty much go up to 5 doses. And as the stomach repairs itself, and it will, be aware that may have to start decreasing, and they probably do, the exogenous HCl, because it says on the bottom here, like I wrote, endogenous HCl production can increase while you're repairing the gut. So make them aware of that. So here's a little schematic for you to go ahead and follow a little treatment protocol. Bile salt replacement, like I said, if they've had their gallbladder removed, you really got to have this on a regular basis, and I believe they need to have about 100 milligrams of bile extract per meal. We're talking about fatty meals now, not little small meals. So definitely keep that in mind. I also want you to be aware, as it says in the 3rd bullet, that bile salts and bile acid is now recognized as hormones, and they're involved in regulation of various metabolic processes. So they're just not there breaking down fatty acids. They actually have a signaling that can go on as well. because they're known to regulate enterohepatic circulation, triglyceride, cholesterol, glucose, and also energy homeostasis in the body. So there's a lot going on, and that's why you need good bile salt replacement as well. So let's go ahead and dive into this irritable bowel thing. It's why you all signed up to go ahead and take this, and I'm very honored to have everyone listen and to help out our patients here. First and foremost, irritable bowel is one of the most common symptom complexes. It is affecting 20 to 30 million Americans alone. You can make an entire practice over this as you get real good at it, and you probably will. The thing you need to realize is that it's pathogenesis. It's multifactorial. There's a lot of stuff going on, right? As it says there, there's contributions of visceral hypersensitivity going on in the gut. There's neuroendocrine dysfunctions, psychological factors, stress like I talked about, enteric infections. That's why you need to do a GI map, stool analysis, find out what's going on. That's kind of your first line of treatment there. Food sensitivities and allergies. You certainly might want to do a food allergy test. That's an IgE test. And also food sensitivity IgG test. Whatever you need to do based on that history, you need to kind of clear the field, and this is your roadmap to be able to do that. So also, as it says next, your new research on treatment of irritable bowel syndrome, it highlights diet and nutrition. I'll be talking about the FODMAP diet on here as well. And remember that if SIBO and increased intestinal permeability, they have been recently implicated with irritable bowel syndrome. So stress, I already talked about that. I talked about the connection with the hypothalamus starting to recognizing stress, producing corticotropin, releasing hormone, and that can cause leaky gut. Please keep that in mind, as well as causing high cortisol and so forth. So stress plays a very important role on functional bowel problems, and in particular irritable bowel syndrome. So here's a little schematic. I love this schematic here because it really shows the relationship, how everything is all related in our body and also to our environment. So here's the brain, there's stress, there's a connection between, first of all, the microbiota in the gut, and there's the gut. They're talking back and forth. There's gamma aminobutyric acid, there's short chain fatty acids, peptide YY, inflammatory cytokines that are messengers. If this is off, that sends signaling back and forth. Here is a gut-brain connection, back and forth. So there you go. So you can get psychological problems, abnormal behavior, cognitive problems, anxiety, autism, visceral pain, all of that, because there's a connection. And also there's hormonal messages going back and forth, back and forth. These are all connected, and there's your functional GI disorders. So certainly if somebody comes in with behavioral problems, you want to address those, stress and so forth. You also may want to ask them about their gut, because I'm sure there's something probably going, or there's probably something going on with the gut as well. So that's your window into helping the gut, stress management, getting proper amount of gamma aminobutyric acid. There's also, which should be probably I should have put on here also as well, is serotonin, because these little bacteria produce serotonin as well. So great look at that. So the diagnosis of irritable bowel syndrome, it's a diagnosis of exclusion because they don't have anything else going on. We really can't find anything out. There's no inflammation. Calprotectin is low. So this is what you probably have, a functional condition. So IBS can develop after an enteric infection. When you're doing a history, so the patient may remember, yeah, last year I was overseas somewhere, or I had a really bad GI food poisoning or something. That can really start a trigger, an enteric infection like that. So once you've ruled everything else, other etiological factors to be ruled out, like I said, infection, C. difficile, viral, fungus, and parasitic infection. You're also going to need to rule out celiac disease, rule out SIBO, rule out lactose intolerance, because all of that can mimic IBS. So you do need to do your homework on there. But I think once at the end of this presentation, you're going to have a good idea on what it is you need to rule out, because I have a nice slide on that, and here it is. This is the list, the conditions that may mimic irritable bowel syndrome. So please keep this in mind. Take this and do a little checklist when you're doing your patient history, like over on the side. Hey, is there any dietary factors going on? Is there too much coffee, carbonated beverages? Their diet is off, and it probably is. Is there infectious enteritis? Do they have amoeba or Giardia going on? Is there inflammatory bowel disease? Calprotectin will go up on that, and also You'll see zonulin and so forth. Is there lactose intolerance? Find out about that. Laxative abuse, intestinal candidiasis. This is where you need your GI map test. Is there a disturbed bacterial microflora? Did someone have like a ton of antibiotics the year before, or even as a child, that it just their gut wasn't right then? This is where your history is important. Is there celiac disease going on with that patient? Very often not really diagnosed. By the way, we have blood spot tests. Vexia blood spot test that you can get to look for and see if that's celiac disease or gluten sensitivity. Really good test. I've done that a lot. It's pretty good. Metabolic disorders. Is there anything going on? Is there diabetes? Is there hyperthyroidism? Is there any kind of mechanical impaction of the bowel, which certainly can happen? You need to talk about the bowel movements. What does it smell like? What does it look like? All that's extremely important. Is there any diverticular disease? That's an outpocketing of the bowel. And certainly neoplasm. If you need to check, we have a FIT test, and that is the fecal immunoglobulin test, as opposed to the food inflammatory test. You can do this particular FIT test to see if there's any occult blood in the stool as well. So your red flags, you certainly want to go over your red flags when somebody comes in with irritable bowel syndrome or symptoms like it or mimics that. So let's talk about some red flags just to make sure, cancer being another one. If there's blood in the stool, and I just told you, you can order a test for that, but you also need to think about prescription medications, because certain supplements and herbal medicine can cause constipation or diarrhea. A lot of calcium, a lot of magnesium, especially a lot of iron, and really only give iron with the benefit of looking at a laboratory test as well. Very important. But you need to consider these different herbs and supplements that can cause constipation and diarrhea, because that may be the cause. Some of your red flags. Some of your more important red flags or serious red flags are this: all of a sudden, unexplained weight loss, fever, overt or occult blood in the stool, if there's rectal bleeding, frequent nocturnal bowel movements, abnormal lab tests. There's again your history of inflammatory bowel disease. If there's a history of colon cancer over 50, if there's fecal soiling on the undergarments, and anemia, because they're losing some blood somewhere along the line. So these would be your red flags. Again, you can just check those off. The diagnostic criteria for irritable bowel syndrome, we're going to talk about this first asterisk right up here. Now that is the criteria fulfilled for the last 3 months with symptom or symptoms onset at least 6 months prior to the diagnosis. So that's what that one is. Now as we go down, now recurrent recurrent abdominal pain or discomfort. The second is discomfort means an uncomfortable sensation not described as pain. They just feel a little bit off. At least 3 days per month for the last 3 months associated with 2 or more of the following. They feel better with defecation, with bowel movements, the onset associated with the change in frequency of the stools, and onset associated with the change in the form or the appearance of the stool. Now I know that was a lot. You're going to know irritable bowel syndrome when you see it, because they're just going to feel off, tell you that constipation, diarrhea for the last 5-6 months. This is just the medical criteria. If you needed to have that, this is what they're going by right now. But I think when you rule everything else out, what else is going on? It's probably irritable bowel syndrome when you do the rule out. There's also some subtyping of this, and this is just for edification. There's irritable bowel syndrome with constipation, there's irritable bowel syndrome with diarrhea, and then there's the mixed form, and then there's the unsubtyped form. I'll let you review those. It's good to know those from a medical perspective, so you know what you're dealing with and what type. They're all laid out here on the slide for you. I don't need to read them to you. I think you can be okay with that. Let's jump into the therapeutic considerations for irritable bowel syndrome. Once other conditions have been ruled out, here's the 4 major treatments, aside from treating the dysbiosis. You want to think about increasing fiber, and I'll tell you which type. You want to eliminate allergic and intolerant foods. Intolerant foods meaning what? Lactose, maybe some foods with histamine intolerance going on. You certainly want to address the psychological component, and you may want to supplement with some peppermint oil if there's a spastic colon involved. Those are the main things. Other considerations, certainly acupuncture. I've had a lot of success with acupuncture with irritable bowel syndrome, and that's working with the meridians, restoring energy and balance of the body as you're addressing stress. Melatonin can also be helpful as well. Again, there's that gut-brain connection. SIBO, if things aren't going right, look for SIBO. If you've given them probiotics, and I'm getting bloating and doc, I don't feel well, that's probably maybe what's going on, because that can be a silent trigger. Next is dietary FODMAPs. I'll be going over those specifically. Those you want to keep low because they can ferment in the gut and cause all kinds of problems. So speaking of FODMAPs, here you go. So what does that stand for? Fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. All right. So in simpler terms, they are carbohydrates that are found in foods. And what they do is they are osmotic. They can draw water into the gut and cause all kinds of problems. They can also ferment. Bacteria can use them. So the trick here is to have them go on a low diet, low FODMAP diet to help out. Here are some foods I have listed here that you want to avoid. Some fructose foods, fruit, honey, high fructose corn syrup. I mean, that goes without saying that you shouldn't have that anyway. That's synthetic bad news. Keep them away from dairy because of the lactose. Fructans or inulin, those are prebiotics, by the way. Of course, certainly wheat, onions, and garlic can cause problems. Galactans in beans, lentils, and legumes like soy. They don't need to be off these like forever, but you really want to start cleaning up that diet and get them on a low FODMAP diet. And polyol, sweeteners containing sorbitol, mannitol, and the rest of them, and some of the stone fruits, avocado, which I absolutely love, and apricots, just initially. Like for the first month or so, maybe 6 weeks, say, listen, we need to straighten out the bowel. We want to get these foods out, and explain to your patient why these foods are drawing water in, causing more of a diarrhea, watery stools, and we just want to address that problem now. You don't have to be off this forever as you're restoring the gut. They can go back to having their avocados and apricots and cherries and so forth later on, but initially you got to prescribe the appropriate treatment. So here are some of the Here's what's the summary of the irritable bowel natural medicine treatment considerations. Exercise. Certainly light to moderate exercise, if you're able to do that, take your pick. Yoga, Qigong, Tai Chi, I love all of those. I'm a Tai Chi practitioner and also a martial artist as well. And I love those exercises. They're very, very helpful and relaxing as well. Mind, body, get them to do something for stress. They need to de-stress. There is a stress component to this irritable bowel. I think you all know that, so I'm probably preaching to the choir. Whether that's art therapy or music or meditation, prayer, relaxation, whatever it takes. Walking on the grass with barefoot is like connecting. That helps out. Get that contact with the with the earth. Very, very helpful. So dietary, the FODMAP diet, low FODMAP diet, like I talked about. Dietary fiber. Now, what's been found out is soluble fiber seems to be helpful, more improvement. That is psyllium, where insoluble fiber may not. That holds more water, things of that nature. So something to consider. If there's food allergy or sensitivity, consider doing what's known as a food inflammation test. We have that at Avexia. You may want to order that. It's a great starting point because you can immediately get them off foods that they are responding to and sensitive to. If you think there's celiac or celiac disease involved, go ahead and order that test as well. There's a blood spot test, and you can order the blood draw test as well. Elimination or modified elimination diet, that really goes with the FODMAP diet as well. That's just getting all the bad foods out of the diet. Next, some botanical medicine and some nutraceuticals to consider. Here's the prescription for the peppermint oil if you choose to do that. It's an enteric coated. And here's right here if you choose to do that. Again, these are adult dosages. Other things that can certainly help out GastroBalance. GastroBalance Plus, that's a nutraceutical by Avexia. It's got the DLG licorice in it, mastic gum, vitamin U, which is known to repair ulcers, by the way. And vitamin U is found in cabbage, if you haven't heard of that. Has zinc carnosine. These are all great for mucosal repair. Gastro Plus more for mucosal repair as well. Good supplementations for you to consider. Here's some probiotics. Again, these are all Avexia nutraceuticals here. Pancreatic, D-zymes, the names are in here. D-zymes also contains the betaine HCl as well. Helpful. Some manipulative medicine. If there's some chiropractors and osteopaths online, massage therapy and so forth, just something you may want to consider that I found very helpful. And this comes out of Dr. Janet Travell, medical doctor, way back when in 1983. Wonderful book on myofascial pain and dysfunction. It's a good thing to kind of take a look at that. Well, what she found is that there are trigger points in the abdominal musculature. And by working those out, sometimes and often by working the abdominal muscles out, they're able to get a decreased in irritable bowel, because these trigger points can trigger what's known as somatovisceral, meaning muscles to the viscera or the gut, problems such as even projectile vomiting, anorexia, nausea, intestinal colic, diarrhea, also urinary bladder and sphincter spasms and all kinds of stuff. So it's something that's not often looked at, but hopefully you all will take a look at that. Just you can Google that as well. There's some wonderful references on that because it really doesn't get looked at a whole lot. There's also, next bullet is opening up the diaphragm and pelvic area, abdominal and pelvic diaphragm. There's a reference for that. Some osteopathic manipulation, working on toning the sympathetic nervous system. And one of the wonderful things, and I don't have it on the slide, if you want to write this down, rib raising technique works extremely well for reducing sympathetic stimulation and relaxing the whole sympathetic nervous system, stress reduction. Next is lymphatic drainage. There are some wonderful information, osteopathic on some lymphatic drainage that can help out with draining the lymphatic system of the body. Hopefully, I wish we had time to go over that tonight. Next, for us chiropractors or not, is and anyone work that T10 through T12 area. That's just above the lower back area. You can work trigger points out there, mobilization in that area. Extremely helpful because all those go to the intestinal area. So you want to work on both ends of that. So that's the whole thing for tonight. I'm going to turn this over to Rob, who does this part of it. And if you have any questions, please let me know. So Dr. Sedano, thank you so much. Rob, over to you.
All right, thank you, Dr. Sedano. As Dr. Sedano mentioned quite a bit tonight, we wanted to just highlight some of the tests. I'm going to turn on my microphone a little bit. Of course, we have screening tests available as that first pass, establishing a baseline for your patients, and it covers a lot of what Dr. Sedano mentioned today. Then once you've got past the screening, from a specialty standpoint, we're referencing the Avexia inflammatory bowel disease panel, and of course with that the GI map or the SIBO tests. So this gives you a real good indication of what's going on, and also allows you to not only screen, but then as you start to prescribe your wellness plan, you do the follow-up testing, and this can tell you how the patient's doing inside. Could you go to the next slide, please, Doctor? Okay. For reference, we have listed all of the nutraceuticals that Dr. Sedano has mentioned tonight, so that way you can refer back. But these are the nutraceuticals, and if you're interested, you can definitely contact our client success team for either the panels, even the basic testing, and the nutraceuticals, and they'll be happy to help you order those tests for your patients. Next slide, please. And here's a highlight on the two bundles that we're offering with part of our nutritional awareness campaign for this month. We have a bundle that has the comprehensive inflammatory bowel disease panel with the SIBO kit and a detoxification kit, a nutraceutical, or the CIP bowel disease panel with the GI map kit and the detoxification kit. So you could order either one of those for your patients. This promotion is good all the way through May 31st. And even though it's not listed here, Dr. Sedano did mention the FIT test. If you believe there's a food allergy test, we also have a FIT bundle available to you. We were going to highlight it during next month's webinar, but it is also available to you now and through May 31st. So if you suspect that you have a patient that needs that FIT test, please take advantage of that of the savings with the bundle. And again, contact the client success team, and they'll get you squared away. Next slide, please. And this is just a general. This is the end of the presentation. The general eligibility reminders. One more slide. All right, and then just the finalized thing. I will now open the webinar up for questions. So if you have any questions, please feel free to ask them. Okay, we do not have any questions tonight. If you do, please, and you think of something, please, info@avexiadiagnostics.com. We'll be glad to answer any questions you may have. And again, as you look at the slide deck, we will make it available to you. Just please send an email and we can get it right out to you. And if you do have any questions in regard to the tests, bundles, nutraceuticals, or a question for Dr. Sedano, info@avexiadiagnostics.com. And with that, I'm going to close out the presentation for tonight. Thank you for joining, everybody. Have a great evening. Good night.